Welcome back to Ananya Child Development Center podcast. I'm your host Madhvi Adimulam. Today we are shifting our focus to a topic that's incredibly important yet often shrouded in stigma, mental health. We are so fortunate to be joined by Dr. Kotipalli Jyothirmayi, a senior psychiatrist here in Hyderabad who's dedicated her career to breaking down those barriers and making mental health care more accessible to everyone. Dr. Jyotirmayi is not only a highly skilled clinician, but she's also a passionate advocate for her patients. She's recently co founded Manaha Clinic in Kokapet, a space dedicated to providing holistic and compassionate mental health treatments. We are so excited to have you join us today, Dr. Jyotirmayi. Welcome to the podcast.
Thank you, Madhavi Garu.
Dr. Jyotirmayi, what inspired you to create Manha Clinic, and what is your vision for this center and what makes it stand out in the landscape of mental health care in Hyderabad?
I was in my MBBS days, so it was around, I think, my third or fourth year. So they had taken us for a trip to Eragada Hospital, Institute of Mental Health. So that was when I was entering this closed wards where the patients were, looking at me and they were doing their own works and some music was playing. I think that was the moment, still I remember, that I wanted to become a psychiatrist. And then all my batchmates knew that Jyotirmai wanted to become a psychiatrist, and they also used to make fun of me. Here, the psych doctor. And later on, after the competitive examinations and the PG results came up, then I opted for psychiatry voluntarily. Not that it was just a leftover seat for me. So there comes the stigma here. So my family, and I was also married then. So my parents' side and the other side and everyone, wanted me to take up some other clinical specialty, not psychiatry, because they couldn't see why I wanted to become a psychiatrist and why I wanted to be called like a mental doctor outside. So, but then I was very much determined to take psychiatry as my specialty. So I took that up and I finished my course from the same Institute of Mental Health, Eragada Hospital. So those 3 years were quite a vast learning experience I had there with all my professors, and there was a huge number of patients coming up from all over the states and outside the states too. So serious mental conditions to mild conditions, all kinds of disorders we have seen. After finishing the course, then I joined a hospital in Hyderabad and I was doing my outpatient services. So I was not into treating inpatients for a while. Then, because I had to handle my other family responsibilities, and later on, after 12 years of finishing my post graduation, eventually I came up with this concept of why do people have to, like, people are going out to spas, to aesthetic clinics for to look beautiful, to look physically beautiful. But why not they come to a center, which makes them beautiful from inside to feel beautiful. So I wanted to start up a place, where they can holistically, they can get all kinds of services. And because people think that psychiatric disorders are some just psychological issues which are somewhere there in the air, but then it is proven that research says all psychiatric disorders have a medical reason behind it. So there are neurotransmitters, neurochemicals which are involved in all these disorders. So I wanted to have neurology, psychiatry, psychology, and neuromodulation under one roof. And that is how this concept came up. So we have a team of neurologists, psychiatrists, psychologists who do therapies, counseling to the patients. And then we also have neuromodulation, which is the new technology, which is called as RTMS, repetitive transcranial magnetic stimulation therapy. And it is FDA approved for depression, OCD, other anxiety disorders, for smoking cessation. And we also use it for stroke rehabilitation, pain management, and the various other conditions. So that is how we came up with this concept and we started this clinic. So patients come here, they talk to the psychiatrist or the psychologist, and if we see that they need, it's like a biopsychosocial model that we work on. So if they are having any biological symptoms, then accordingly we treat them, get any investigations done. And if we doubt that maybe some other neurological condition is also involved, like let us say someone comes up with memory issues. Memory issues is a symptom, but why it is happening? So we kind of try to rule out any medical conditions like any deficiencies, any hormonal changes that they have which is causing the memory issues. And if we administer some questionnaires and scales to them, trying to understand what is the severity of those memory issues, and if required, if needed, then we refer them to our neurologist. And because there is also a psychological element associated with it, the person can have mood changes and all, so we can also get the patient, get the counseling services. And then there is the social biopsychosocial model, where how the person is doing in their own community, that is in the family, how the occupation of the person is, and how they are with other friends and family outside. So this is an example that I have given. So like that, there are many other symptoms that the person can come up with. So rather than labeling them as disorders and all, trying to see how the person can fit into the community well is our main goal.
That's a wonderful vision, Dr. Jyothirmayi. Creating a space that feels safe and welcoming is so important for individuals seeking support for their mental health and neurological well being. And I'm particularly intrigued by Manaha's comprehensive approach, offering services in psychiatry, neurology, and psychology all under one roof. I'm particularly intrigued by neuromodulation therapies. Can you explain what these therapies are and how they work to address mental health conditions?
So, neuromodulation treatment is done by a machine, and which is called as this treatment mode is called as RTMS, that is repetitive transcranial magnetic stimulation. So, the name itself suggests that there is a magnetic field and the stimulation, that is the brain is stimulated. As opposed to earlier treatments in psychiatry, one must have heard about electroconvulsive therapies. So, electroconvulsive therapies are very good for people with severe depression and all, but there are some issues that a person might not want to go with it because they are interventional. So, the current neuromodulation, the RTMS, is non interventional. So, after thorough research by many scientists and all, so this has been FDA approved as well. So, here the main mode of treatment goes with creating a magnetic field and then stimulating the brain neurons. So, wherein that area of the brain, let us say it is a left dorso lateral prefrontal cortex for depression. So, that area we kind of stimulate it by the magnetic field. So, there is faster improvement in depression. So, almost 7 out of 10 that is what the studies say, that they get improved. So, any patient who is having a lot of medication related side effects, or the treatment, they're not responding to medications, they are treatment resistant, that is, and they need faster improvement. So, RTMS would be a better choice for them.
So this particular treatment can be blended with your psychotherapy or other therapies,
Very
medication.
much, yeah. Very much. It can be along with the medications, it can be given as well. We also do maintenance therapies later, and along with counseling and therapy, psychotherapies also, it can be done.
Manaha emphasizes on addressing the root causes of mental health issues. How do you go about identifying those root causes? And what are some examples of how you might tailor treatment plans to those specific needs?
So, when we talk about the root causes, so let us say, for example, an adult comes with lot of anxiety issues, and I had this patient who had a specific phobia to get married. So, she didn't want to get married, and whenever the concept of marriage, or the parents used to talk about marriage, she used to get palpitations and she used to get panic attacks too much. So we just don't try to resolve symptomatically just the anxiety part then and there and relieve the anxiety, but we'll have to try to understand why this person is having so much fear about marriage. So we delve deep. Every adult's the root is the childhood. So we have to talk about their childhood a lot. See what went in their childhood. What did they observe? How was the parenting? How was the academic performances? And what kind of adverse childhood experiences this person had? So whether she had any abuse from someone, any bullying was done, or the parents were conflicting. So when we dig deep, we do get hints about why the person might be having these anxiety issues with related to marriage, let us say. And then there is something called genetic predisposition. We have to dig deep into whether either of the parents of the child is having any other anxiety issues that the person is more predisposed to be anxious. Then we try to rule out any other medical causes which might be causing anxiety, like hormonal problems like thyroid, PCODs, and vitamin deficiencies, and any other medical reasons. So we try to rule them out, and then we try to take a comprehensive family history also. We talk to the family members also about how the person is responding and how the person is suffering. And then we come up with a treatment plan with, let us say, we combine both pharmacotherapy, non-pharmacotherapy, that is psychotherapy for the person. And then we kind of jot down how many sessions the person should be having from the psychotherapist. And then we explain them why the need for medications, if at all, what could be the probable side effects, or how long duration the person has to use, what the protocols say, so that they get a comprehensive idea about their treatment regime. And if required, we refer them to other specialties.
So that's very comprehensive answer. So what drew you to working with not just adults but also children and adolescents with this innovative approach to mental health care? And what do you find particularly rewarding about helping this younger population navigate their mental and neurological health?
So, when we come up with treating a particular person, so it is not that one person that we treat with, but we have to also consider the family that is involved. And when a child comes, and usually, like I have earlier explained about the adverse childhood experiences. So, if we prevent these adverse childhood experiences, and if we focus more on the child and the child's mental health, so what I feel is there will be lesser psychological issues when they become adults. So the next generation, there might be lesser burden of mental health issues, and the society might be in a better quality of mental health.
And mental health is as such a big stigma in India. Slowly we
Correct.
are getting there. Now people are at least talking about.
Correct. People are talking about it. We see celebrities also talking about it. So I think we all have to share our own experiences as well, because we all, like as a mother, I went through 2 deliveries, and the first 1 to 2 months, post delivery. So even I had those postpartum blues, which you actually read about everywhere. So I think we all do at some point, experience some of the other mental health issue, which we have to talk it.
So there is still a lot of stigma, as we already said, surrounding mental health, especially when it comes to children. What are some of the common misconceptions that you encounter, and how do these misconceptions prevent children from getting the help they need?
Yeah. So the misconceptions associated, I think one might be that we kind of blame too much on like screen time, or blame too much that the child is just, picking up the mobile and he's just using mobile phones, he's just watching TV all the day. And it's so easy to blame this non-living object. But then when you see how the child has got this mobile in his hand, or why the child has started, watching all of this. So somewhere to do with is the time that parents should be allotting to the child. So when a child is in distress, or when a child has committed something, like let us say an offense or a mistake or anything, then I think we have to delve deep into why the child has done this. It's not the fault of the child, but why, what actually drove the child to do this. So we have to question the circumstances involved. So never pinpoint a child that the child is to be blamed for the child's mental health issues. It's not the child actually, but it's the circumstances which are involved and the people which are involved around.
Absolutely, Dr. Jyothirmayi. Normalizing mental health conversations and encouraging families to seek help is crucial. Moving on to a related point, what are some common signs that parents should look for that might indicate their child is struggling with their mental health? And what are the red flags that shouldn't be ignored?
Mhm. So, a child who's been active earlier, let us say the child has become very silent, doesn't do their homeworks properly or finish their works properly, keeps losing things, very frequently, or anger issues, or reduced self care, doesn't show interest in getting ready, doesn't show interest in eating their food, or they don't sleep well. So I think these are some of the red flags. Mostly sometimes the child might not be able to verbalize their innermost feelings like adults, like I want to go away, But we need to see if a child who has been normal earlier and now suddenly becomes silent, doesn't want to talk with their friends and all. I think these are clear cut, red flags, and we have to sit and talk with the child about it.
So, Dr. Jyotirmayi, do you have any number? How often does this mental health issues occur in children? And is there a statistics or data?
So we have the data, collected from the National Mental Health Survey. So it found that there are mental health issues among children and adolescents, and it is quite concerning that about almost 7% of the children and adolescents experience these mental disorders. But I can say that this actually might be only the tip of the iceberg. There might be a lot, undiagnosed, hidden beneath.
Yeah, because even at Ananya, we have seen significant rise in children who approach us. Mostly, we used to get children for academic related issues or learning disorders and things like that. It sounds like paying attention to changes in a child's behavior, mood, and social interactions is crucial. Turning to another important topic, anxiety is a common experience for many children, but it can manifest in different ways. What are some of the underlying causes of anxiety in children, and how can parents understand what might be triggering their child's worries?
So, let us say anxiety is actually a normal human response or emotion to any threat from outside. Then a person's autonomic nervous system gets activated and they become anxious. So, with respect to children, different age groups, if we see, so initially the child who's getting separated from the mother could be having a separation anxiety, going to the school, but slowly the child gets adapted to it. But then in a group of people, sometimes these children can have social anxiety, or the child also can have a problem eating, in front of children, or keeps crying about it, or doesn't want to go to school, school refusals. Why? Maybe the child is anxious about going to the school and meeting children. And also, if the child has sub-average intelligence and has problems with academic performance, a child could be having some specific learning issues as well. So if there is any criticism in the school, or if anyone has bullied the child, then also the child can have issues with going back to school, can get anxious, very anxious, because of their low academic performances as well.
So, ADHD is a condition that's often misunderstood. What are your thoughts on the diagnosis and treatment of ADHD in children? And what advice would you give to parents in Hyderabad who are seeking support for their child with ADHD?
So, coming to ADHD, or attention deficit hyperactive disorder, so though it looks like a very serious terminology and parents can get quite stigmatized with attaching this label to their child, so let us just consider the symptoms. If we see any child who is very hyperactive and which is interfering with the functionality of the child, And just being hyperactive or active we cannot diagnose, or just being inattentive we cannot diagnose as ADHD. So ADHD has to be diagnosed by proper psychometric assessments done by professionals, because there is a criteria which we have to match. There is a thin line between being overactive and then being hyperactive. So after, if the person fulfills this criteria of ADHD, then we diagnose it and then we start the treatment. And mostly with the children, we start with a non-medical management of behavior therapy and all. And only if the child is not responding or the severity is too much that is hampering the child to continue with the academic performance, then we also have medical management for ADHD. It's a treatable condition. With proper support, the child can get back to their normal state of life.
Thank you so much for those insights on ADHD, Dr. Jyothirmayi. Moving on to another important topic. Autism is often a complex and multifaceted condition. What are some key signs that parents should look out for when it comes to autism in children? Additionally, how can parents differentiate between typical developmental variations and signs that may indicate autism?
So I think one very key thing to this is early diagnosis and early intervention. And I would want to stress this even more, because if your child is not able to talk, there are language delays. Please don't wait for with time the child may talk, but please meet a professional to do a thorough assessment, because the early you diagnose this condition, the better would be the improvement for the child. So one is the language issues, language delays. The second is if you see that the child is not paying eye to eye contact or having difficulties in social interactions, then also please meet a professional. So I think here your pediatrician can help you with any doubts regarding if you have about your child. But the early diagnosis is the key here.
So, another important question I would like to ask today is, many parents are hesitant about medicating their children or using medication. What role does therapy play in addressing mental health challenges in children, and what are some of the therapeutic approaches that you find most effective in children?
So any parent would be apprehensive of starting any kind of medication, especially if it is a psychiatric medication. I do understand that. But based on the set protocols and based on the guidelines, if a child has mild to moderate, we do start with a non-pharmacological treatment only, like behavior therapies, and we try to do a proper parental training also, because that is where the parents can play a key role in trying to do changes with the child. And only after that, if the symptoms are not getting resolved, and sometimes we do keep them on medications which are very beneficial, because see, we had this child with autistic traits with a lot of issues in even doing therapy, because what's happening is the child had a lot of self-harm behavior to the extent of harming themselves too much. So in those cases, we do initiate them with a low dose of a medication which should help them out. And these are all evidence-based medicines, and the doctors are going to psychoeducate the parents about the child and start the medications.
Lot of times they go to a psychiatrist, the doctor gives them the meds and they don't ever use them. They come and tell me, they show me the prescription and said, have you used this? They say, no, we got scared, we never used, and we never went back to the doctor. So that I think is very detrimental if they want the child to be helped. So it sounds like medication can be incredibly powerful tool for helping children developing coping skills and build resilience. Raising a child with mental health challenges can be isolating for parents. What advice would you give to parents in Hyderabad who are seeking support? What are some resources or organizations they can connect with?
Yeah. So one advice that I can give to the parents is that you're not all alone. So there are many people who are going through these challenges. So there are support groups as well now, wherein the parents come and sit and discuss about their children. So there are several organizations, and one of them is Manaha. So Manaha does provide services catering to the family as a whole, for children, for parents, for the whole family, the extended family as well, to provide a safe environment for their psychological growth. Please feel free to approach a professional for any of your family member if you feel that they must be suffering or you are suffering, because one has a right to be happy, and all these sufferings can be reduced by proper help which is given on time.
It's reassuring to know that families don't have to navigate this journey alone. We often talk about self care, but it can be especially challenging for parents of children with special needs. What are your thoughts on self care for these parents, and how can they prioritize their own mental health while caring for their child?
So, just like when we are on the flight, so the advice given to everyone, especially the parent, is keep your oxygen mask and then keep it on your child. So, a similar advice, like the parents, you have to please take care of your mental health need first. You have to be stable first to take care of your child effectively and properly. So, I think all parents, with special needs need to have a thorough psychological evaluation or talk to a therapist to vent out their feelings. And that's how they can actually feel better and provide a proper treatment for their child as well. Because the one who's suffering, cannot help the other one who is suffering.
Dr. Jyothirmayi, this has been a truly insightful and encouraging conversation. Thank you for your time, your expertise, and your dedication to helping families thrive.
So thank you, Madhavi Garu. I enjoyed thoroughly too for sharing my experiences with you. It was nice talking to you.
It's been a pleasure. I hope our discussion today will empower parents. For our listeners in Hyderabad, if you are seeking compassionate and personalized mental health care for your family, I highly recommend reaching out to Dr. Jyothirmayi at Manaha Clinic in Kokapet. You can find more information about her clinic on their website at manahaclinic.com, and be sure to visit the Ananya Child Development Center website www.asap.org.in, where you will find Dr. Jyothirmayi featured in our new recommended physician section. This resource provides families in Hyderabad with a curated list of trusted medical professionals who share our commitment to supporting children and families.